Well, definitely accessibility is a huge issue, but I will tell you honestly, it's making sure that Tennesseans are healthy as far as educating folks on healthy living and healthy lifestyles. Well, I think there's some innovation on the horizon. I mean, I like the concept of direct primary care. It's certainly the doctors that I have talked to that are participating in it really like it. It allows them to be proactive rather than reactive in a person's life. And the patients that I've talked to here in Nashville that are a part of a direct primary care really like it because they get that one-on-one attention from a doctor. So they pay a monthly fee and then they get set services and then they participate in what would be a high cost, low ability to have health insurance if they need it. Well, I think I have a proven track record as Speaker that any legislation that comes before my desk that involves the health care, I've always taken the time to reach out to the Tennessee Medical Association and ask for their input, and they have always been willing to come to the table and sit and work things out. And so certainly I would continue that tradition as governor. Well, certainly for someone, I would like them to have a background in the medical profession, that they would have experience in actually caring for patients. I think that gives them a level of compassion and understanding that would be sorely needed, and certainly a person with a level of expertise that could work towards problem solving and, again, engaging all the stakeholders. Well, we've come a long way in the state of Tennessee with tort reform in 2011. I was very honored that I got to, as Speaker, work on, I think, what was a very good tort reform piece of legislation. And I think it's made an enormous difference. We've kept medical liability costs down, and we want to make sure that we preserve that. So whoever I would have in that department, I would want them to be very committed to the tort reform legislation that we currently have in place. We want to make sure at the state level we do all that we can to make sure that federal policy does not harm the actual practitioner. And so we would do everything we could. I do have a good working relationship with our two U.S. senators, and hopefully that would continue, and we could make sure that policy coming out of Washington, D.C. does not hurt our physicians. Well, I don't think the two are exclusive. I think really they go hand in hand. I think when the more safety that we have in place, the more that we keep infections and et cetera down, the healthier folks are, and actually the less expense that we have in our healthcare system. So I think the two work hand in hand. And again, that's where the profession could certainly help us at the state level know what is our proper regulations and what go beyond what is necessary to do. We don't want to put over regulations on our physicians. We want to do all we can to make sure that they have good practices and feel comfortable in their profession. Of course, especially in our rural areas. And one of the things I think is an innovative approach that we're taking at the state level is we formed a partnership with MTSU, Middle Tennessee State University, and Meharry to offer a medical degree at a little lesser cost with the understanding that those folks will go and practice for a certain period of time in our rural areas where we lack primary care physicians. That's the type of innovation that certainly the state can be partnered with the private sector to accomplish some good things for our state. We have had expanded Medicaid in the state of Tennessee. We had it up until 2005. When Governor Bredesen came into office, it was consuming our budget. It was completely out of hand. That was a large tax debate going on at the time, and that is when Governor Bredesen removed close to 200,000 people off the rolls. So it's not a new concept to the state of Tennessee. Personally, I think the legislature took the right course of action. We can easily look at states that have already expanded Medicaid in their states, and their rural hospitals are closing at the same rates that are happening here in the state of Tennessee. It was not the panacea. It was not going to solve all of our problems. I'd love to see more people have access to care and additional health care, but we have to be reasonable as a state because we have to live within our means. I think the medical liability reform effort that we have taken place in this state makes this a good state for a doctor to practice in. They just want a level playing field. They want to be treated as professionals, and as much as we can allow them to do that with unnecessary regulations and rules with them, and certainly a legal community that respects what they do, and they're not always worried about the lawsuit hanging over their heads. I think the important thing there is we certainly appreciate our nurse practitioners and want to include them, and they're a necessary part of delivery, especially in some of the rural areas. But we also understand the key role that the physician plays in proper oversight. Well, I think that they have ultimate responsibility, and so therefore there always needs to be a physician in charge. And I would leave it up to you all as to how many you adequately can supervise of nurse practitioners. I think we have pretty good laws in place. It's always becomes a little bit of a turf battle when how much can a nurse practitioner practice without direct supervision. And again, I look to the medical professions for input on that. I want to make the right decision, not just for your profession, but really for the safety of the patient. Well, I set up a task force, and we really traveled the state and learned just how pervasive it is in our state. The good news is we've actually seen the number of prescription opioids go down in our state. The bad news is we still have a problem. We still have an issue. And so the task force made a number of recommendations to the governor, and then the governor came forth with his proposal, which we are working on right now. Certainly, we would love the input. I've heard from a number of doctors that live in my district, and I appreciate when doctors reach out to me and let me know how they feel. It is still a work in progress, and I welcome input. But certainly, we are doing some things not only in prevention and law enforcement, but certainly in education. We have reached out to our colleges of medicine across the state so that we begin to teach pain management in a little bit different light. That will help and go a long way. We are in negotiations with the governor. The governor prefers a set number of drugs that can be prescribed at one time. I think the legislature is leaning more toward a partial refill. But I think at the end of the legislative session, you're going to see us take some significant steps that will help. And certainly we are putting additional resources and hiring additional TBI agents that will be located in both East and West Tennessee to try to prevent the illegal drugs coming into our state. Right, and I've heard from a lot of physicians regarding episodes of care, and certainly the whole idea was cost containment, and so I respect TennCare Bureau for attempting to rein in costs because they keep going up by about 7% every year, and we can't sustain that. But you can't contain your cost at the expense of our doctors. And so I think doctors have proven that they're willing to work with the administration on this, and I would be willing to work with them. But definitely what I think we need to do is freeze the number of episodes of care right now before we expand any more so that we can work out the problems that exist in the program, and there are some problems. Well, I think that's certainly one of the things that we can look at. It's an expensive program, and I can't tell you how many young people that are pursuing medical degrees wake up leaving medical school with tremendous debt. And so anything that we can do to offset that, it's certainly valuable to the state in the long run because physicians are the key to the entire healthcare system. I feel good about where we are in medical liability, and I certainly want to maintain where we are. If there's areas of improvement, I'm very open to those, but we worked very hard on that legislation, and I think we have one of the best laws in the nation. Well, I think that we should allow our state boards to regulate the profession, and sometimes the national exams are an opportunity for a private company to make some money. I honestly think that we can handle this at the state level and not involve national licenses, which tend to be very expensive for physicians. Well, I certainly understand that no one likes the surprise bill. I've experienced it myself, and it's not a good feeling. And so I want to balance. This is a balancing act, protecting the patient from a surprise bill. But there's also, I think, a balancing act that we have to allow physicians to be able to negotiate a proper rate for them from the providers as well. Source of information. I really do see it that way. And as you imagine, when you are a state legislator, especially speaker, you're asked to, make comment and have an understanding of a lot of different issues. And no one can be an expert on everything. And so to have the Tennessee Medical Association and Impact always available to meet with elected officials and to tell their point of view, it's invaluable. It really is, because few folks realize, but it's at the state level that we regulate all health professions, and so we need and want your input. Well, physicians are very, very busy people. I don't need to tell you that. And so much of what happens in state government directly impacts their lives, their professions. And so to be a part of the TMA and Impact gives them a way to have a voice without actually having to spend the time on the Hill keeping up with everything on a daily basis. So it's a source of information for them as well. Well, without a doubt. I think your financial help for someone running for office can make all the difference for especially a state legislative race. It has a tremendous impact then on having accessibility to your elected officials. So it's a wonderful program. And of course, it's up to the elected official to always balance the information that they receive. But certainly, you have a wonderful reputation of being a good spokesperson and really being helpful to our legislators, and we appreciate that. Well, again, I hope I have a proven track record of being very accessible. My door is always open, and as I'm fond of saying, I like to work things out on the front end rather than on the back end. So I would really love to have your input as we formulate health policy in the beginning, so that we can work closer together, because we really have a lot to work on in a state. We want to be a healthy, prosperous state where physicians want to come and practice and live.